The DUART trial, it was a phase II global international study sponsored by AstraZeneca, where we recruited patients with stage 3 locally advanced disease, so with mediastinal involvement, large tumors, unfit for chemoradiation because of comorbidities, frailty, or age. So again, a population which is considered outside from standard clinical trial. Also, PSC-GOG2 patients were allowed to enter, and we tried to use standard or palliative radiation therapy according to the treating center. Then we administrate Durvalumab at a fixed dose, one dose every month for up to 12 months to all patients. And our idea was to improve the historical result of radiotherapy alone, that without chemo are very poor because overall survival expectation, median overall survival was below 10 months. The results were very positive in terms of overall survival, because the median overall survival of the whole cohort was 21 months, and especially the safety was very good. I mean, despite the fact that these patients were elderly, 79 years old mean age, true elderly patients with many of them with comorbidities, especially heart and pulmonary comorbidities. We had a very low grade of serious adverse events, below 10%. In particular, the rate of pneumonitis was very low. So at the end, the treatment was very well tolerated and was very promising. One more thing that we did, plasma and blood samples, we detected circulating tumor DNA, and in a fraction of patients, we measure at cycle 1, cycle 3, and cycle 7. And particularly at cycle 7, if these patients have molecular response, clearance of circulating tumor DNA, despite the radiation dose they receive, either palliative or curative, and despite the stage or comorbidities, they can reach very, very good progression-free survival rate. So this is the first time that we show that without chemotherapy, there's a proportion of patients that can be cured by a combination of radiation alone and immune checkpoint inhibitors.